Morning, ladies and gentlemen. Thank you for finding the time to come and join me for this presentation. Let me introduce my group members, Yanisa, Pichayanin, Wanwalin, Siriyakon, Onkamun, and I'm Supempi Kithachalanchai. We are sophomore in the Faculty of Architecture at King Mongkut Institute of Technology, Lat Krabang, or KMITL in Bangkok. The topic of our presentation is sexual risks. In our presentation, we focus on four major issues. Firstly, factors affecting adolescent sexual behavior. Secondly, the effects of premature sex. Thirdly, sexually transmitted diseases. And finally is protection. At the end, I will be happy to answer any of your questions.
Okay, the next topic is factor that influence adolescent sexual behavior. Divide into three main topics. 1. Predisposing factors. 2. Auxiliary factors. 3. Motivating factors. These three topics are factors that influence sexual behavior as follows. 1. Affect oneself such as sexual development. Then physical, mental, emotional, and social changes. 2. Sexual abuse resulting from substance abuse. 3. Family effects such as family relationships. Family composition in which parents and children should live together. And good family standards. 3. Effect on those around them, such as same-sex relationships on heterosexual relationships. 4. Social and cultural implications, such as the social status between the rich and the poor. The choice of media to disseminate information about sexual behavior on even the culture and lifestyle that people can empathy inherit. The next one, the effects of premature sex. 1. Unwanted pregnancy is a major problem, especially the mother has problems with growing it and may have health problems of the fetus as well. When panic, anemia, or preeclampsia may develop, and if the pregnancy continues, there is a risk of bleeding, and babies often have problems with low weight, premature birth, including possible death after birth. 2. Abortion. Before the child can survive outside the mother's womb by adolescents who unwanted pregnancy often lack the availability of child care, therefore decide to have an abortion, most of which are cynical abortion. That is legal. 3. The occurrence of sexually transmitted diseases. Rising trend due to sexual behavior, insecure and lack of knowledge and understanding of prevention themselves lead to viral infection.
Next, I will present about firstly symptoms. For example, symptom of HIV, raised temperature, or fever, dryness, and body rash. Next, symptom of chlamydia, pain when urinating, pain during sex, and bleeding after sex. Symptom of trichomoniasis, genital redness, burning and itching, pain when urination or sexual intercourse. Symptom of gonorrhea, painful urination. In women, vaginal bleeding between periods such as after vaginal intercourse. Symptoms of hepatitis C, breathing easily, brushing easily, fatigue, and yellow discoloration of the skin and eyes. Symptom of syphilis, Syphilis develops in state and symptoms vary with each state. You may be infected with syphilis and not notice any symptoms for years. Symptoms of genital herpes: pain or itching, scrapes, and small red bumps or tiny white blisters. And the last example, HPV, or human papillomavirus. Symptoms of HPV may appear years after the initial infections. Some types of the virus cause wart to form, while others can increase the risk of cancer.
Okay. Next is sexual protection have a main 7 topic. 1. Always wear a condom when having sex. Condom offer the best available protection against STI by acting to prevent the exchange of semen or blood between partners. 2. Do not share multiple sexual partners. Limit your number of sexual partners. Talk honestly with potential partner about parts of your sexual history. 3. Keep clean. Use plain unperfumed soap and just stick to a gentle rinse with warm water after sex. 4. Shouldn't have sex during menstruation because risk of spreading a sexual transmitted infection STI like HIV. 5. Do not touch a vagina. Studies have found that women who do were likely to have bacterial vaginosis. 6. Shouldn't have anal sex. Anal sex is the riskiest threat so sexual behavior for transmitting for both men and women. 7. Anal health check.
At present, adolescent pregnancy bring about sexual risk. So, we want to know about factor effects. Adolescent sexual risk behavior, such as HIV, HPV, syphilis, and other things, including the effects of premature for teenagers, adolescent pregnancy rates. In order to quality of the life are better than adolescents. So, we would learn about sexual risk to protect myself from every risk. Thank you all for listening insight into the sexual risk.